Welcome to Well Balanced, Achieving Health Equity for Women of Color Through Financial Wellness. I am Dr. Nicole Carter, the founder and executive director of Hughes Women's Health Advocacy Institute. This program aligns with one or more of our four strategies of care, and those strategies are communities and conversations, which this program falls under, access, and advocacy, which also could connect to financial wellness, research and resources, educational awareness, which definitely this program falls under. Sorry. Today is Equal Pay Day to somebody, meaning for certain women, March 12th, 2024 represents how far into the year the average woman must work in addition to their earnings last year to have earned what the average man, and that is certain men, had earned the entire previous year. It highlights the inequities in wages and underscores the ongoing fight for equal pay. And this date specifically correlates to the earnings of white women, because that's why I said somebody, to white women and white men who earn a certain amount. And this date serves as a reminder of a persistent gender pay gap. It draws attention to the fact that women on average earn less than men for the same work that they do. The date of Equal Pay Day varies each year. And so if you ever paid attention to it, it changes from year to year. It symbolizes how many extra days into the current year women need to work to catch up to men's earnings from the previous year. Um, and so, specifically, white women working full time and year round are paid an average of 84 cents for every dollar. And it's also important to note that that varies by state. Um, and so, if you're interested in that information or the breakdown, just you can that information is widely available. Disparities are even greater for women of color and women with disabilities. So Black Women's Equal Pay Day would be July 9th, 2024, officially. And so that's the date that they would have to work into the new year to make that same amount as a white man at the end of January in 2023. And they earn around 66 cents for every dollar. And then Latina Equal Pay Day is October 3rd, 2024, meaning Latina would have to work into October, all the way to October, almost the new year, in order to make that same amount. And then Native and Indigenous Equal Pay Day is November 21st, 2024, meaning they would have to work into November in order to make that same amount that a white man would make at the end of January. So, why is this relevant to the discussion? Well, we're talking about financial wellness and how financial wellness connects to health equity. And it's important to note that there is a deep, significant relationship between the two. And the pay gap is one of those things, but also the pay gap connects to wealth and the ability to build wealth. And without that ability, health equity can't really truly be achieved. And so the conversation is important and it should be ongoing. And so this is the first of what I hope can be many conversations about financial wellness and its relationship to health equity. So Carla is a three-time graduate of Wright State University, where she received her BA, MA, and MPA. She has been employed in the social services field and local government for 29 years in Dayton, Ohio. 4 years ago, she started her journey as a How Money Works educator with WealthWay, and she's also recruiting. I saw that some new educators, if anyone is interested, to work with her. She holds a life and health insurance license, Series 6, 63, 60, and 65, and is a certified financial educator. Her passion and mission is to empower people to take control of their financial future and help families create generational wealth. Uh, Carla is very active in her community. She is extremely. She is involved in numerous nonprofit organizations involving the Hispanic and Latino community. She is president of the Puerto Rican American and Caribbean organization, PACO. She sits on the board of El Puente Educational Center. She is the president of the Wright State University Amigos Latinos Alumni Society and is the director of the dance troupe Hey Lindo es Panama. Carla is also involved in several women's groups and organizations, including being on the board and the board treasurer of Hughes Women's Health Advocacy Institute. Carla lives in Dayton with her husband Marvin and her fur baby Rena. Rena, am I saying it correctly?
Raina, yeah, Raina.
Raina. So her fur baby Raina. She has one adult daughter, three adult stepchildren, and a grandson. And so, welcome, Carla. What does financial wellness mean to you, and how does it contribute to overall well-being?
So to me, financial wellness means how well a person manages their financial life. Um, and there's seven key areas that we focus on that we feel really need to be addressed to have an adequate level of financial wellness. We call those the seven money milestones. And we're very focused on helping people with these areas. Number one is having a basic financial education. You don't have to be a financial guru, but you need to understand, the time value of money, the power of compounding interest, why it's important to shop around for the best interest rates when you're saving, not just when you're, taking out a loan. So we start with empowering people by just giving them, financial education because you need that to be well financially. Proper protection. You have to ensure that your biggest asset is properly protected. And oftentimes when we ask people, what's your biggest asset? Most people, if they own a home, are going to say it's their home. They may say it's their car if they have an expensive car. Some people who are kind of financial savvy may say, oh, it's my 401k account. But actually, your most um, precious or your most valuable asset is your ability to work and generate income. That really is your most valuable asset. And so you have to have that protected. Number three, the third area that encompasses financial wellness is ensuring that you have a proper emergency fund. We recommend that you have 3 to 6 months of either your income or your expenses saved for emergencies. Because if you do, you really never have an emergency. Things become an emergency when you don't know, how to solve that problem. So having an emergency fund that also keeps you out of debt, which would be the fourth milestone that we talk about. Striving to eliminate and reduce the amount of debt that you have. The statistic I think is that 50% of Americans don't have $400 saved in case of emergencies. So that's why on the flip side, credit card debt is now at an all-time high because people turn to the credit cards when they have an emergency situation. Um, then we talk about cash flow. How to increase your cash flow. So there's two ways to increase your monthly cash flow to make sure you have you know more money in a month instead of a lot of people when you're living paycheck to paycheck. You really have more months than your money. Um, so you can either make more money, which a lot of us do have. Uh, Other jobs that we do. I do financial services, but I also work in local government. But then the other way, without just going out and getting another job or another income stream, is to set a budget and stick to that budget. Look at areas that you can eliminate. For me, it's always eating out. When you live a busy lifestyle, you tend to eat out a lot. And simply packing your lunch is a way to eliminate the unnecessary and to increase your cash flow without, earning any extra money. And then the last two topics that I think encompass financial wellness are probably the things that people think of when they think of someone being financially well. It's like, building wealth and building assets, but really you can't get to that point of building wealth if you haven't taken care of the things I just mentioned. So, looking long term to build enough wealth that really the key is to outpace inflation, which we know right now inflation is crazy. We feel it every time when we go to the gas station or to the grocery store, and taxes. We think taxes are high, but with everything that is going on in our country, I don't know. We just got to make an educated guess. Do we think taxes are going to be lower in the future? Probably not. So you have to be, again, aware of how you can build wealth and get enough interest off of your long term savings so that you're outpacing, taxes and inflation. And then lastly, where a lot of people fail, even some wealthy people, is in properly protecting their assets, in ensuring that their legacy is protected through a proper estate plan. So to me, those seven components have to be addressed for you to really be in a good space when in terms of your financial wellness.
I have some follow-up questions, but I think the other
Okay.
questions that we have will kind of answer the follow-up questions. So
Okay.
if they don't, then I'll ask the follow-up questions after, but because they're all connected. So the next question is it's addressing the term intersectionality of health and wellness, basically the intersections of health and wellness, where they align. Well, health and financial wellness, where they align. So, can you share examples of how financial stress can impact physical and mental health? Um, and there's another question, and I'll ask it again, but I'll just say it ahead of time. How do health disparities affect the financial wellness of women of color? And this is also where we can kind of have a conversation about those things too. But so the first one was how can you share examples of how financial stress can impact physical and mental health?
Yeah. So, finances and not having your finances where you want it to be, it can be a big stressor for people. Um, I mean, how many people do you know and love, or maybe even yourself? I know this has been me in the past that maybe have had a sleepless night or two because you're worried about, how you're going to make ends meet, how you're going to pay the mortgage or the rent or keep the lights on, or even beyond that. Um, maybe you're doing a little better financially, but now, student loan payments came back. How are you going to pay your student loans when you haven't been paying them for a while? So I think not having a, a good financial plan and not being in a good financial place does cause a lot of stress, which then can lead to anxiety, lead to depression. Um, I mean, healthcare isn't my area of expertise, but we know that when your mental health is suffering, then your physical health starts suffering. And then I think it becomes a vicious cycle because if you're not well physically, then you may not even be able to go to work to improve that financial situation. So, getting caught in that cycle of you're not doing well financially, affecting your mental health, affecting your physical, affecting your ability to work, and just getting caught in that cycle.
I will say, because so this is where, like, so that's my part of the contribution of the conversation. But so a recent research article, literally January 2024, it came out and it discussed that even working women work full time, make a salary, so not hourly wages, but like salary. 56% of working women have complained of anxiety associated with living paycheck to paycheck, and the financial stress that the financial burden, and how that impacts their mental health. Um, and mostly the discussion is centered around the mental stressors. But as you stated, there is a direct correlation between physical and mental health. But then we also know that often one of the first things that we will push aside when we can't afford certain things is healthcare. So like a copay or for copay for prescription or doctor's visit, health insurance, what have you, like that premium, right? If we are paying out of pocket, it is not paid for out of like through an employer or something like that. And so the fact that that number said basically the majority, I mean, it seems like, and I think that is a general number as well, but the fact that the majority of women who are going to work, you know, and earning the salary are stressed about their finances, and that does correlate to the social determinants of health. So the first one cited by health.gov and the federal government and the CDC is economic well-being. So and or stability. So, and that is stated because that is deeply connected to access. So, being able to pay your insurance premium or get insurance when you're working for an employer or when you're self-employed. Doing that or paying for prescriptions that are not necessarily covered for things, paying for procedures that are not always fully covered, different things like that. And so the preventative care is what it falls to the wayside often when finances are tight. So yeah, it's deeply connected. I knew that that wasn't your like official background, but that's the whole goal is to demonstrate how those two things align. And I will put my follow up question out there because you mentioned like one of the seven um, key areas or steps that should be focused on. One was like budgeting and things like that. And my question is, where does the budget come from when it's when you don't have much, right? Like, and it you also brought up the foregoing food, like eating out and things like that. Um, I know that's the area I need to focus on because DoorDash is like my best friend. Okay, but but also when you don't have these other options in certain neighborhoods, like grocery stores, things like that. Well, grocery stores with healthy and quality produce, things like that. Um, it can be kind of enticing to just go to Burger King or McDonald's or Wendy's or something like that,
Yeah.
as opposed to cooking at home or going, also when you're working multiple jobs um, or a job that, like it's difficult to get out of or your schedule is you're working at night or something like that. You might just feel like I'm going through the drive through and getting this food and going to work or going home and going to sleep. And so um, I don't know. Did I ask the question? I think it was a comment.
Yeah,
Well,
well,
it was.
you did ask a question. How do you but where does the budget come from? So, in general, you have to kind of to create a budget. Everybody's budget's going to be different, but you need to kind of track your expenses um, for I wouldn't say just a month. I mean, if you could track everything that you spend for, the last 3 months, then it's going to give you a better picture of how much you actually are spending at the grocery store or eating out or on gas or just shopping. And it can be very eye opening because the reality is most people don't have budgets. They know what they pay what they have to pay, and they have money left over. Some people do make it a priority to save, but you spend what you have left over without actually, categorizing and looking at what you're spending your money on. And as with anything, if you're trying to reach a goal, sometimes you have to suffer a little bit in the interim to get to where you're wanting to go. As an entrepreneur or anything, you're going to have a couple, really rough years to then see your business flourish. But it's the same with your personal finances. Um, we love to have new things. Well, do you necessarily need, a new purse, new clothes? You know, how much stuff do you actually have in your closet that you don't use? But those are things that you have to be, um, really consciously looking at because if not, I know I feel like I work hard and if I want to go buy something, I should be able to buy it. But you got to kind of make a decision. Do I need to forego that to pay off this credit card so that financially I can be in a better position? But it's just starting. It's taking that first step to sit down and take an honest look at your finances and how you've been spending your money. And there's all kinds of, apps and trackers, and a lot of the banks can do it for you. If you primarily use your debit card, it can categorize your spending to make it easier for you to see where you're spending your money.
So the next question actually is connected to what we were just talking about. It actually we kind of addressed it, and it was about the what role do economic factors play in shaping health outcomes. I mean, we kind of discussed those things, so we know, like I said, financially, when it comes to prioritizing health and paying co-pays and engaging in activities that are deemed preventative, it becomes difficult when financially you can't make ends meet. And so you begin to, those things fall by the wayside. You might decide, well, I'm not getting that prescription this time. And this is coming from somebody who has done that, right? Like even when I had a full time job at a university, those were decisions I had to make. And I literally, in fact, am right now in DC, went to a talk on health equity, and one of the discussions was about it was salary poverty, like women of color specifically who have these full salaries but are still struggling to make ends meet. Often it's just them by themselves, right? Often it's just, but sometimes I know for me, those lessons, those 7 things, I didn't learn those. I literally just learned those here, right? So I knew some of them, some of the components, but for me, that's part of one of the issues is not knowing
Yeah.
the steps that can be taken. So that does go into the next question about strategies, because you kind of you those were strategies, but maybe we could talk about more specifics.
Yeah.
And so the next
Yeah.
question is, yeah, go ahead.
No, I was going to say to just piggyback on the socioeconomic, something that came to mind to me as well. Having, my daughter's 27, so she was actually, and she's entrepreneur. She's an esthetician, so she was on my insurance here at work till 26, and then got kicked off. So even navigating the healthcare marketplace and looking at, okay, here's the options and here's how much it's going to cost. And yeah, she ended up getting insurance, but you got to kind of fit it within your budget. So you're not necessarily getting the best insurance. I know the first year that she came off that insurance plan, we looked for doctors and there was like nobody took it. So here you're paying a premium for something that nobody is even going to take. So yeah, socioeconomic factors play a big role
Definitely.
in health.
And that is a good point to the even with insurance, depending on the type of insurance, what like say you've been going to a doctor all your life and now you have a new insurance and now that doctor doesn't take that coverage. Now what? Because you had to, like kind of downgrade or change insurance
Yeah.
coverage, carriers, or even certain services are covered that you need. One of in terms of policy, one of the things that are like is being pushed is ensuring that insurance companies cover mental health services, because that is still not a guarantee all the time. So, but it that is deeply, like that's still health. Why is it not covered, right? So, but depending on the type of insurance you have, it might not be. So
Yeah.
yeah, that is definitely important to bring up. Even with certain coverage, even with like if you're still depending on something like the marketplace, um, certain things still might not be covered. It just depends.
Yeah.
And then the fact that you also brought up that you did research on it, like you like tried to see what like if doctors would take certain things and it wouldn't. There are people who would just give up, right? Like I just
Yeah.
so that's another aspect of things too. The next question, and it's still related to it, but it asks about the strategy.
Mhm.
So, what are some practical financial strategies that can address the unique challenges faced by women of color? And I do want to point out in the chat, um, Deasia had reiterated something you stated, and this is because it relates to the strategies. That's why I'm bringing it up. But kind of monitoring your finances for 3 months. So one of the questions associated with the strategies for me is why is 3 months like a good amount of time? I mean, I have a idea as to why, but
Well, I think 3 months is a good time because, it shows your habits.
mhm,
I forget exactly what the days are, but it takes like 21 days to create a new habit or something like that. But
mhm,
3 months is going to show your spending habits. You can be good for a month, but 3 months is really going to show what your spending habits are. So that's why I would recommend 3 months. In terms of strategies, I mean, some of them align with the 7 things that I talked about, but number one is really start talking about money because money is something that people are kind of taught not to really have discussions about money. Not and certainly not supposed to ask how much people make and things like that. But we need to talk about the things that bother us, that possibly keep us up at night. And for a lot of people, money is probably one of those.
mhm,
And number two, as far as strategy, well, it's really not number two. It kind of aligns with number one, is in talking about it, you know, everybody could use a coach or you can work out on your own if you're trying to lose weight, or you can get a personal trainer. So if there's a professional that you can trust to talk about things, then I definitely recommend getting with professional. You need to know what your situation is, and for a lot of people, that's difficult. I can remember even when I 4 years ago, 4 or 5 years ago, got into this business. I started as a client. I was looking at, I'm going to be retiring in, at that time, it was like 8 years. And where am I financially? Especially being a government worker, we oftentimes just think, oh, well, we got a pension. I'm going to get my Ohio PERS and I'll be fine. But so it was hard at the time being a professional with a good salary, at that time earning nearly six figures, but seeing how bad I was doing financially in terms of carrying balances on credit cards, not having an emergency fund. Credit cards were the emergency fund. So when I say that, I'm speaking from experience. And again, I was someone who had a good salary and just didn't know how to manage my money. So knowing where your situation, that is definitely a fundamental strategy that you have to tackle, and you have to be honest with yourself on where you are financially and your commitment to changing that situation. I talked about cutting out the unnecessary. And it's not just eating out. And I'm not saying never eat out. I still eat out, but I certainly try not to eat out every single day because for a while, being a busy, person, I was eating out for lunch and dinner. Like I didn't cook at all. So much money just out the door on eating out. But think of your subscriptions like Netflix, Hulu, Amazon Prime, Disney Plus, Paramount Plus. I mean, how many TV subscriptions or music subscriptions? Spotify, Apple, iTunes thing. So look at those subscriptions. That's another place where people are spending, unnecessary money on the subscriptions. Um, but you really got to know your financial situation, know your financial habits, and then make a commitment to make a change and have a plan. Like, you know, you may be here financially, but where is it really that you want to get to? And that's going to be different for everyone because then you can create that plan to meet your financial goals. Um, and commit to having goals, and goals should be short term, medium term, and long term. So you have your 1 to 3 year short term goals, you know about 5 years, 5 to 10 years, your medium term, that may be more like a dream vacation or buying a house, and then your long term goals should center around your retirement And what are the other thing that people just don't talk about? What are you going to do for long-term care? Because the reality is that more frightening than, just dying is being ill, especially being ill in the latter part of your life. And if you can't work, and how are you going to care for yourself? So, having a strategy in place, not just for retirement, but for long term care situations. And then committing to saving and investing. If people aren't familiar with investing, get with a financial professional that can walk you through that. It's not about all about being invested in the stock market and having that risk that the stock market poses. Um, there's risk with every investment, but there are ways to be invested more in like index funds that mirror the stock market, but can provide you with some security on the downside, some buffer, so that you're not losing money when the stock market is down. So I would say that, talk about it, get help if you need help, know your situation, set some goals, commit to, eliminating the unnecessary, start working towards your goals, and save and invest.
Well, one of the things that you brought up, well, and it was kind of throughout the suggestions, was this financial professional. And so,
Mhm.
we're often told to seek um, the help of a doctor, like a physician, mental health professional. I actually feel like there is something, I don't know, it made a light bulb go off, because I wish we could kind of cover services where we talked with women of color about financial wellness, and as a means of helping with health equity, and covered it for them, because so many people, like so many of us, would never seek out a financial, like an accountant, financial educator, um, things like that. But that's something my dad lives by. He has, for years. And that is how he actually fixed his credit. That's how he, like, has now been able to garner wealth, as opposed to just saving, learn about investing, different things like that. And just to add, investing for a lot of people can be scary, but it actually, there are different apps now for investing. Cash App has an education component, and I'm gonna be honest, that's how I invest. It was through Cash App, and I it teaches me about, why investing in a particular thing, and not the company per se, but like why I should invest in this industry
Industry,
opposed
yeah.
to this industry, right? The best time to invest without committing fraud. But yeah, so but it's like, there's an investing 101 associated with it, which those things are, an investing club for women. I follow on Instagram, so I do love investing. That is an area that I am happy that I started doing that, about 2 years, actually, during the when the pandemic started. That's when I started doing the investing stuff, because that's when I could sit down and learn more about it.
Yeah.
And I often invest in the health related companies that, I'm getting all these medications from. So,
Yeah. No,
so
no,
it's,
especially during the pandemic. The
yeah.
hell, they were trying to find vaccines and stuff. The healthcare uh, industry was booming, and so that
Hmm.
was definitely an area to invest in.
Hmm. Yeah.
Right now,
Um,
the hot topic is AI.
yeah. That's,
Yeah,
so I invest in Microsoft and Google. But I intentionally invested in Microsoft because of AI, like
yeah,
not Google per se, but specifically because of AI. But it also means that you become more knowledgeable about those industries as well. So,
yeah.
um, and if you get dividends. So the more you invest, the more dividends you get back. and that can be used for savings and different things like that. So,
Yeah.
okay, I
Yeah. So
digress.
it's definitely something that everybody, um, just be a well-rounded person, and just like you study up on other aspects of your life and your well-being, finances is definitely an aspect that everybody needs to learn more about.
Yeah. I mean, and that's one of the reasons why we're focusing on it as part of Hughes is because the various components of wellness. It is my belief in particular that in order to really be well, period, those areas of wellness must be attended to. There is no health without financial wellness.
Yeah.
It's deeply connected to our health and well being. And so it's just something I wish more people, knew about, understood, and but I know historically we've we've been in positions, and talking about social positions where we weren't supposed to know that information, but the only way to transform these things is usually by becoming
Yeah.
educated ourselves to begin transforming these spaces. So health, social, cultural, whatever it might be, they're interconnected. So um, the last question is, and I actually I just talked about that, so this is great. So it asks, how can financial education be tailored to empower women of color specifically? So
Yeah. So, actually here lately in my business and what I'm doing, um, we are focusing a lot on not just women of color, but women in general. But I think how financial education can be tailored is that, women need to understand the important role that, they play in society. And as you mentioned, social norms have made it that, the man takes care of the finances and women are kind of kept in the dark on their family's finances. I know a lot has changed, but that is still the case for some women. But I think knowing our role, knowing what the statistics are. You talked about women make, I think you said 84 cents. The statistic I've been using is 82, but as you mentioned,
mhm.
it varies from state to state. So 82 cents for every dollar. I did not have the statistics on Black, Latina, and Native
Mhm.
women, so that is eye opening. So at 82 cents for every dollar, I think they say the average male salary in the US is 61,000, women 51,000. That's a $10,000 difference.
Mhm.
So that's huge, especially when women a lot of times are like single moms or caretakers. But then when you start looking long term, that becomes even more impactful. So a $10,000 difference over a 40-year career, that's $400,000 that a man will earn that more than a woman. Um, then you look at Social Security, if it's still around when we retire, but Social Security, that means a woman's only going to get 80% of what a man is. So at every turn, this is affecting you moving forward. Um, some of the reasons, are because we are caretakers. We have children. Oftentimes, we put our careers on pause to take care of the kids, or usually when there's an elderly parent, it's not the husband that takes time away from his career to take care of grandma. It's usually, the wife. So all of those pauses are what cause this gap and continue to cause the gap. And we just need to really understand that because the statistics are, there's more women than men. The statistics are that by 2030, which seems far away, but that's literally what, 6 years, by 2030, women are going to control 30 trillion with a T of the assets in the United States. That's two-thirds of the wealth of this country. So if we don't understand how money works and don't understand how financial concepts work, you know, how detrimental is that going to be when we're controlling most of the assets? Um, so you kind of couple that with the fact that we live longer. So we make up 70% of the nursing home residents. I think women are like two-thirds of Alzheimer's patients. So, we're going to be here longer than men. We're going to, fall into these situations where we need to understand how to manage our money so that we can prepare for the latter part of our life. Um, I think another statistic is that 80% of men, um, when they pass away, they leave. They're married. When they pass away, that leaves the woman a widower. So most 80% of women then are passing away single with no one to help them. So it's just absolutely imperative that we know these statistics and that we learn how to manage our money. Um, we utilize a book. It's called How Money Works for Women. And what I like about the book is it's really simply written with cartoonish characters, but it takes nine women at all different stages of their lives and talks about finances as it relates to them. So there's like a 9-year-old college student. There's a middle-aged woman who was recently divorced. There's the widower. There's a woman who has an autistic child that has to deal with the financial burdens that come with having a child with disability. So sometimes seeing those stories, there's usually one or two that either you can relate to personally or at least someone you know. You can see someone you know in the character and seeing how they are working through their finances through the examples in the book. That's the educational system we're using to try to reach out to women and get them to become more financially literate.
And I do think that's important. I did write the book down, but
And don't go
what's
on
the title?
Amazon and don't go on Amazon and buy it. Get it? I'll give you a copy. So
Okay, yeah.
we don't
And
want anyone to
Ebony
go out
asked,
there and
yeah.
and buy
So
books.
it's
It's
How
called
Money
How Money
Works for
Works.
Women.
Yes, and it was written by Kim Schooler, who is works with WealthWave, and Sharon Lecter. And Sharon Lecter, she collaborated with the Rich Dad Poor Dad. She wrote Think and Grow Rich for Women, which, Napoleon Hill wrote Think and Grow Rich a long time ago. Well, his foundation got her to write the book for women. So she's very, has written 20 some books in the financial space. And she collaborated with our company with this book. But again, we're not here to sell books. So you can probably go on Amazon and buy a book, but nobody do that. Just contact me and I'll give you a complimentary copy.
Okay, thank you. I mean, but I do. That's what I was going to say. Like that is, I think having representation of women from different, experiences, different states of wealth, if you will, different ethnicity, races, and or ethnicities, different like parents, college students, like you mentioned. I think it's also extremely important that they had a woman who had a child with a disability, because that's something that I think it gets we forget about caregivers. We think when we think of caregivers, we think about the old traditional parent, whatever that means now. But and a caregiver of a parent, an older parent, but
Yeah,
not a parent of someone with a disability or multiple children with disabilities. So
yeah,
yeah, that is extremely important to center different women in that education. And then the other thing I would say is making education about finances more palatable and bringing it to spaces that, so like we're having a conversation now, and like health industries, health related companies and organizations talking about financial well-being, financial wellness. It belongs in all of these spaces. And that's really
yeah.
the only way that things are going to change, is when it is taken out, I think, out of like banks and out of, like not that it doesn't have a place in things, but like if we want to reach some other people,
Yeah, make it more
we need to go.
accessible, more inviting, less intimidating.
Mhm.
Um,
Yeah. Yeah, I'm thinking of like beauty salons, like different, like having conversations in places that you wouldn't normally have in. Um, because now I want this book, and I have a love hate relationship with money, but now I want the book because it seems like it will assist in a lot of ways. So, yeah.
yeah, absolutely. I will get you a copy.
So I do want to go to the audience and ask if there are any, or the folks who are participating, if they have any questions. You can put the questions in the chat, or you can unmute. I think you can unmute. I'm pretty sure. Um, and ask questions if you have them. Um,
I do have a question.
okay.
Can you guys hear me?
Yeah.
I can.
Okay. So for young adults that are like your daughter, when you said that she was taken off of your insurance. So for young adults that are going through a process of just now getting insurance and things like that, how do you think is what's the best route for them to go as far as just figuring out the whole like insurance process? Because I'm 24 and I got my own insurance, but like my mother isn't really, she doesn't really know much about that. So honestly, I've been out here just winging it, but there are things that pop up like co-pays and things like that. And, of course, I have to pay it if I want to be seen, but I would like to be more prepared for those type of things. And I'm not sure really how to go about that. So, what are your thoughts on that?
Well, my thought is your insurance through the marketplace or
It's through my job. So, I'm a
okay.
teacher.
Okay, so I would say definitely get with if it's through your job, you should be able to get your your certificate of coverage that tells you how much your co-pays are going to be, how much the deductible is, and familiarize yourself and be knowledgeable of what these things potentially are going to cost you. I know here at my employer, you can pick the low, high, medium, or high plan. So every year when we do our renewal of our insurance, you really got to kind of look like which one is going to be more beneficial for you and your healthcare needs. Because the low plan is cheapest, but then if you have um, some medical issues, it's higher deductibles. You have to pay more before it kicks in. So you really, you should be able to get with your HR department, and they're going to know, you know, how to give you the certificate of coverage and everything that's covered. But just be, knowledgeable about that and study that. You don't know what you don't know, so you have to um, get the information you need to make informed decisions on a different insurance topic. I would say you said you're 24,
Or, mhm,
24. What about life insurance? Do you have life insurance other than what your employer might provide?
no.
So that's something that you definitely need to look at getting now. And no 24-year-old is concerned about life insurance because people think that life insurance is, for when you die. And of course, nobody thinks they're going to die in their 20s. And I'm not saying you are. I'm saying life insurance now is very different than what we used to think of just, term and whole life. It's going to be cheapest now because you're 24 years old. You're young, you probably don't have ailments, you're going to get the cheapest rates. The second part to that is that there's life insurance that is permanent and it also builds um, cash value. Some of them are invested in the market. So a lot of them it's almost like a separate, investment account. It's something that's going to take time to grow, but you're 20. So when you get ready to retire in 30 or 40 years, you're life insurance will have accumulated to a value that, if you set it up correctly, if you have a long term care incident where you can't work and you need to be cared for, you can act instead of spending your money or your money that's in your 401k or whatever to pay for this illness, you can pull off of your life insurance if you set up your life insurance correctly. Or maybe your value is to a level that you want to start pulling out of it monthly, almost like to supplement your retirement income. So there's a lot of things you can do with life insurance, but getting it now while you're 24 and it's going to be super cheap is your best route. So I would definitely look at getting some life insurance, now.
Okay, thank you.
You're welcome.
Another question in the chat. I do want to just mention though, I never knew until my dad told me that life insurance, you could certain life insurance companies, the investment is like investing in, I mean, it's essentially investing in a company, right? So in their market, and so he one of the he has multiple, but one of the companies he is like building, upon that investment and has been paying towards. He's about to be 80, so we can imagine how how much he has invested in that company. But if things happen, he can, take that out and use that as opposed to other funds or something like that.
Yeah. And while you mentioned taking out from what I didn't mention is that proceeds from life insurance, even when you're like taking out as a supplement to your retirement, are tax free. So most of our retirement savings, when we're saving into 401ks, 403bs, IRAs, they're usually what's called qualified funds, unless you have a Roth IRA. That's my other recommendation for you at 24. You need to open a Roth IRA. That's a type of individual retirement account that you fund with after tax dollars. Most of our retirement accounts are funded pre tax, and we think it's a great thing. Like we deposit into our retirement account before the government taxes us. Um, and, we think it's tax deferred. We think it's great. But what you have to realize is the government's going to get their taxes at some point. And when they get their taxes is when you go to withdraw that money when you're now in retirement and withdrawing your money. Again, are taxes going to be higher 10, 15, 20 years from now? Probably. But then the second part to that is, are you going to be paying more taxes? We use example of, a farmer seeds versus the harvest. Do you want to pay taxes on seeds or do you want to pay taxes on your harvest? So what a Roth IRA does is, because you're using after tax dollars to fund that account, then it's able to grow tax free, and your withdrawals when you go to withdraw in retirement are not taxed. So that's my other recommendation for young people is, as soon as you can, open a Roth IRA. But the tax advantages, that's another good reason to get the life insurance. I did see a question here. Do you think private insurance is better than insurance from an employer? I'm going to say no, just because what you got to think, when you have insurance from your employer, they're paying, at least every company I've looked at, they're paying the majority of that premium. That's why your cost is less. Of course, this is coming from someone who I've always worked, so I've always had insurance through my employer. I haven't had to get private insurance other than when I assisted my daughter. So that would be my answer on that one. I don't see another question.
That's the one I was going to add. Private insurance. Are there any other questions? Well, I definitely, I can foresee us having some more conversations about financial wellness and with some practical applications of what you're stating. And so one of the things that I've been encouraged to do with our roundtables, webinars, is provide a call to action. So if you could provide, tell us one thing or one or two things that you believe that the people who join and the people who will watch when it is posted online, one or two things that you can do to kind of leaving here today that we should do. You already talked about the Roth IRA, you already talked about life insurance. And is there anything else you would tell us to do?
Yeah, I mean, my first big one would be, life insurance. If there can ever be a time where there ceases to be people posting GoFundMe's, that would be great. I honestly can't imagine the stress that you've already lost a loved one and then you don't know how you're going to bury them. So life insurance, everybody needs it, and don't just depend on your employer's life insurance plan, because you're not going to necessarily work there forever. And I will give a practical example of this. Knowing someone who only had employer life insurance all the way up to they retired from their job, 32 years they retired. And then at that time, here's your options with that life insurance. It's a group plan through your employer, and you can either, convert it to an individual plan for yourself and incur all of that cost, which it becomes very expensive, or you just have to let it go. So it was something that you couldn't incur that cost, so they let it go. So now you've worked 32 years, you're now older, and your life insurance, to get life insurance, it's going to cost you so much more. So get your life insurance policy that is outside of your employer. Invest. Roth IRA is my recommendation to supplement not all your eggs in one basket. This isn't going to be the only thing you do, but do a Roth IRA to supplement your retirement income, and then just make a commitment to make a budget, to look at your finances, to know where you're at, and to set some goals and try to achieve those goals. Those would be my calls to action.
All right, thank you. So we were scheduled to go to 5:15, so this is actually perfect. We were done in 6 minutes, with 6 minutes to spare. So if there are no other comments or questions, I do want to thank you, Carla, for providing us with a wealth of information. And I will also have the transcription with the YouTube video, so people who want to look through the steps that were given, the strategies, it'll be listed there in the summary of the video. And we'll hope to schedule some more opportunities to have these conversations. Maybe we can do one October 3rd. What day was that? Latina? Yeah, Latina Equal Pay Day. We can do one in October. Yeah.
That was thank you for that information, because that was very eye-opening.
Yeah, I can send you the list. It actually has. I have a breakdown of the amounts as well. So so for Latinos, it's 50%. So yeah, it's pretty bad. Yeah,
there's definitely a lot of work to do. So yeah, we need to keep having these conversations.
Yeah, and it's 2024, and things are still. Yeah. And then they fluctuate. They get the dates, they move up sometimes, and they get further back. So get pushed back. So yeah. So thank you again.
Thank you.